Welcome back. Now, ensuring proper dental hygiene for toddlers is crucial for their overall health and well-being. Today, we have the privilege of speaking with Dr. Kagiso Moloi as we delve into the importance of early dental care, practical tips for parents, and strategies to make oral hygiene a positive experience for toddlers. Let's explore how we can lay the foundation for a lifetime of healthy smiles. Doctor, good evening and welcome.
Good evening to you, Nina, and thank you for having me.
Thank you so much for being here.
Good evening to the viewer.
To start with, Dr. Kagiso, talk to us about the key dental hygiene practices that parents should follow for toddlers.
Before we go there, I just want to show you this picture. This picture shows adult teeth growing in green and baby teeth. They are there on top. So the reason for baby teeth is to make way, to make a good passage for the adult teeth to come out.
Right.
So that's very important to know that before we can go even into the oral hygiene.
The baby teeth is what we also known as the milk teeth.
The milk teeth.
Right.
Yes. Yeah. So basically, the importance of thereof is that you are creating a conducive growth pattern for the teeth that are going to come, which are your adult teeth. We've got 10 milk teeth and 20 milk teeth and 32 adult teeth. So the 32 adult teeth must fit where the 10 were. So it means we need a jaw to grow it as well, so as to accommodate the rest of the other teeth.
Right, right.
So the basic principle, it's just ordinary toothbrushing. Firstly, before the teeth up, you can brush on. You use a gauze swab. This is a gauze swab, and you use a pea-sized toothpaste.
Amount of toothpaste.
Yes.
That toothpaste that's supposed to be pea-sized, doctor, can I use like the normal Colgate or whatever brand that the rest of the family uses, or do you, would you recommend that you use a brand that's more toddler friendly? Because you do get the ones that are for babies.
The reason we say pea-sized, we are considering the fluoride factor in the ordinary toothpaste. So that's why we are saying a pea-sized, so that the child doesn't swallow much of the fluoride.
So you can use normal toothpaste.
Pea-sized, it's ordinary toothbrush or toothpaste for the family, and you use your gauze swab whilst you are bathing. You just put the toothpaste and you just go around, and that you do in the morning and in the evening. And then as the teeth grow, you go to the toothbrush. So it will be your toothbrush and your toothpaste, which is a pea-sized.
Right.
Which is a pea-sized, and you go in a circular motion to make sure that you don't miss any spot, even between your gum and your teeth. You are able to go there, and you can feel the
bristles.
The bristles.
Very soft.
They are very soft bristles, so they are very comfortable for the baby.
Yeah, yeah. How do you get them into this routine? Because a lot of times when they start getting teeth,
that's about 5 months, 6 months.
So do you start at 5 or 6 months with getting them into the motion of brushing in the morning, brushing in the evening?
As you do your brushing, just do theirs. Or when you do when you bath them, just make sure that you also do that for them.
What tips do you have to make it fun for the toddlers? Because you know those ones like to keep the kids entertained.
You compete with them on who does the brushing the best.
Right.
And you've got a prize for them. The prize, it can be in the form of a fruit or any other thing except sweets. Because the problem with sweets, it increases the bacteria levels in the mouth, and you end up with dental decay.
Yeah, yeah. Some parents would say, or even some health professionals would say that, at the first sign of your toddler getting teeth or your baby getting teeth, that's when you should, start with a routine for brushing and also make your first dental appointment.
Yes.
Others will say wait a bit longer until they may be 1, 1.5 or 2 when they've got more teeth, and then make an appointment to go to the dentist. But what's your opinion on that, number one?
My opinion is that as soon as there's teeth in the mouth, when you set up an appointment for yourself, just take them along so that the dentist can see whether the development is fine, are the teeth okay, they don't have any other problems like fluorosis or any other thing. So they're able to check, because there's something called sealants. There's something called sealants. Sealants is something that we apply on the baby teeth. So is this acrylic looking like with a whitish thing there? We apply it so that the teeth don't proceed from having little cavities to bigger cavities. So to keep that tooth there, we just put a fissure sealant, and the fissure sealant will make sure that there's a longevity of the baby tooth until it's time for it to go out by itself.
Talk to us about how important having a balanced diet is for toddlers in terms of maintaining good oral health.
Yeah, basically having good balanced diet is very essential for all other things in your body parts. Actually, you need magnesium, you need potassium, you need calcium. Calcium mostly it will be for your bones and for your teeth, and all these other minerals are necessary for just normal growth of the child or of the toddler. So you need to make sure that those are balanced: the greens, the yellows, the orange, and your fruits. Make sure that they are in a balanced form, and make sure that if they are not in a position to eat yet, just make sure that you can mash whatever. If you have a banana or you've got an apple, you can just heat up the apple a bit to be able to crush it.
Right.
The banana, you do the same, and all other fruits, just make sure that it's easier for them to consume.
Dr. Moloi, what's the most effective ways to help prevent cavities in toddlers?
The most effective ways is, as I said, is just making sure that you've got a fluoridated toothpaste with your brush or your gauze, and that size, pea-sized. And fluoridated toothpaste, they must not consume much of it, because if they consume much of fluoride, they are going to cause problems with the adult teeth that are developing. They are going to have something called fluorosis, brownish teeth. Usually people from the south with a high content of fluoride in their water, they've got brownish teeth. So to avoid that, you must consume less of the fluoride.
We do know that, of course, with toddlers, they're drinking, water now, they're drinking juices, they might have some toddler tea, and some parents like to put some sugar in it to make it nice for the babies. And of course, that should be done in moderation. But there are instances when that doesn't happen. I want to know, when the teeth get to that stage that you've got now, that picture on your iPad, and it's that damaged, does it affect the adult teeth that have to grow later in its place?
It affects the adult teeth, because we are going to need to remove this some of these teeth, because they've got bacteria, and the bacteria causes other diseases to the toddler. They can cause lung problems. Because your mouth is a gateway to your body. So anything that is in the bacteria that is in the mouth, if it ends up in your body, it causes problems. So we are going to need to remove that tooth, and if we remove that tooth, the gum grows over that part, and when the other tooth is supposed to come out, there's no path now for it, because there's no tooth there that is holding position for it, so it can grow either direction. So that's why you end up with many children now having to put on braces, because the teeth are not growing in the direction that they are supposed to be.
So if you have the teeth removed, because I know some parents will have babies who have teeth that are damaged, and to them it's like, well, it's milk teeth, it's baby teeth, it will fall out. They shouldn't leave it. It's better to have it removed instead.
It's better to have it removed. As I said, the bacteria that is contained in the mouth is the most potent bacteria you can ever find in a human body. So make sure that bacteria doesn't go further into your lungs, into your kidneys, and causing other infections within the body.
Mm-hmm. You've got the toothbrush that you've got there, doctor. It's more for an adult, but would you recommend that you use that, or should we rather go for the the kiddies ones that are
the
full of characters?
Yeah, the ones full of characters, and they've got big holding handles. Because it makes it interesting for the child to see their favorite Superman or Spider-Man on the toothbrush, and also it is a bit smaller to fit the size of the mouth.
Mm-hmm. At what age does the adult teeth start coming in?
The adult teeth start coming in when they start school. Have you seen the
bunny teeth that fall out?
The gap. So when they start school, around about 6, 7, that's when you start seeing the adult teeth coming, and that's the time. Then you should make sure that you do it with the child, the brushing, so that they get used to it. And as I said, make a competition who can brush the best, and you know that you are just encouraging them to brush.
Yeah. Well, Dr. Moloi, thank you so much for your time, and thank you for being here this evening.
Yeah, it's always a pleasure.
That was dentist Dr. Kagiso Moloi speaking to us about dental hygiene practices for toddlers.